I'm currently the director of the Cancer Research Center on the Hampton University campus, and I was tasked with uniting all of the cancer research expertise and work that's going on currently and bring it together under one umbrella so that the whole is greater than the sum of the parts. And so I'm very excited about the work we're currently doing at Hampton University and how we're engaging the doctors over at the Proton Therapy Institute, because I can't do my work without the patients.
I am a clinical researcher. I've been doing proton therapy clinical research for now 24 years, and I came to Hampton in 2010 to start up Hampton University Proton Therapy Institute because of my interest in doing clinical research. I am excited to be able to work with Lulu and her team in doing genomics and applying genomics to our treatment. Yes, we treat patients at Hampton University Proton Therapy Institute, and yes, we do hopefully a good clinical service for these patients. But we have another mission, and that is to identify patients that are ideally suited with protons and to identify how to best treat them with protons. Everything we do at Hampton University Proton Therapy Institute is either clinical or basic science research involved.
So one of the things that I've learned doing research and engaging with physicians is that patients are often treated as one size fits all. And what we're trying to do is use genomics again to personalize treatment. Proton therapy, chemotherapy, radiation therapy may be associated with some side effects. But through research, we can actually try to mitigate that if we can recognize or if we can use genomics to determine if a person needs less therapy or more therapy. And so research can actually not only help move treatment and management along, but also can improve the lives of patients by improving quality of life. If we can use genetics or genomics to predict who's going to respond or who's not going to respond, or who's going to have a better response, who's going to be an ultra responder, or who's not going to respond as well, and who needs a little bit more therapy, that would improve the quality of life of patients tremendously. Survivorship overall is going up, and so now there's a real big focus on quality of life. What do we do with these survivors? How do we improve how they live for the next 10 and 20 years? And so I am really interested, and we are working together with the physicians to do this type of research to try to understand how genomics can, again, not only help improve the management and the treatment, but also improve the quality of life in the patients.
I have the unique opportunity here at Hampton University Proton Therapy Institute to treat many unusual diseases. I specialize in tumors at the base of the skull, down the spine, and in pediatric tumors. And so I will see tumors that are not known by the public generally, that don't get the awareness that breast cancer does or prostate cancer does, but are nonetheless very serious. Some of the tumors I treat, for instance, there'll be 3,000, 4,000 cases a year in the United States. We are becoming a referral center for base of skull tumors, for expertise in these tumors, and we rely heavily on the community to support us with their surgical skills, their diagnostic skills, but we bring these, the knowledge base for these patients together. And to be able to integrate that with Lulu and her genomics and with the educational services. The nursing students come over and spend time with us. I'm delighted. I've got one of her students with me right now. And this young lady who's a senior going into pre-medical, or she is pre-medical going into medical school, she actually goes in and sees the patients with me. And she helps our nurses out right beside her. That is education at its very best. So we are bringing research, we are making the state aware of the resources, we're bringing the population together, and we're contributing to the education of our students and population in general.
So the Proton Therapy Institute and the Hampton University Cancer Research Center are partners in research, education, and treatment. We are doing research, we are educating our students, we are trying to improve the lives of our patients and the quality of life of our patients. We're trying to improve how we treat these patients and how we manage their disease, and ultimately, we're trying to cure this disease. So I'm happy to partner with the clinicians in this research endeavor and assist in any way and improve the lives of patients in the Hampton Roads area.